Hello and welcome to this week's podcast. Today we're going to talk about age-related vision changes. I'm Stephanie Bedford, a registered nutritionist based in the UK, and my guest today is an optician, Garrey Haase. So Garrey, can you introduce yourself?
Yeah, with pleasure. Hi, Stephanie. So my name is Garrey Haase. I'm a qualified optometrist and I have three practices in North Yorkshire and East Yorkshire. I've been qualified as an optometrist now for over 20 years, and I'm married and have 4 children with my wife, Karen.
It's great to speak to you today and hear more about the kind of things that people need to look out for as we age. Everybody knows that we get to an age where we have to wear the reading glasses, but I understand there are some other conditions that we need to look out for as we age. Is that right?
Yeah, no, that's dead right, Stephanie. There are the aging eye, like the rest of the body, there are different things that can happen to an aging eye. As you already correctly said, the most obvious thing is that we need reading glasses. And that's a condition called presbyopia, which is a Latin word that just literally means old eyes. And what happens is our arms don't get long enough and they get shorter and shorter, and we move things further away. And it's not my eyes, it's my arms. It's always my arms are not long enough. But we need reading glasses. And so we struggle to focus on close things. And the other thing that happens is that we all naturally just become slightly long-sighted as we grow older. So the distance can change a little bit. And if you're already short-sighted, then as you become slightly long-sighted, your short-sightedness reduces.
Oh, that's so interesting. So one of the things that I've been very interested in over the years as a nutritionist is about type 2 diabetes and how that becomes more prevalent in middle age. And I understand that there are also some serious effects that can have on your eyes. Could you tell us more?
Yeah, type 2 diabetes and type 1 diabetes, of course, can affect the eyes like it can affect the rest of the body. And it affects the eyes because of the blood vessels. So as I'm sure your listeners will be well aware of, the blood sugar levels are what control your type 2 diabetes and your type 1. As the increase in blood sugar levels go up, then it can make changes to the blood vessels. And so you're going to get these vascular changes. And with diabetes, we have 3 different stages of eye changes with blood sugar levels and diabetes. So the first stage is in the infancy. It's called the background retinopathy. And it's where you get subtle changes to blood vessels. You might get the odd leak, and usually they're not sight threatening. They don't usually have any impact. And as long as you get your blood sugars levels back to normal levels, then it doesn't affect the eye. The second stage we call pre-proliferative retinopathy. And that's where we get more significant changes, more significant bleeds, more fluid that leaks between the layers of the retina. And that can often be sight threatening and change your sight. And again, if you can get your blood sugar levels controlled, sometimes with laser treatment as well, we can often maintain and manage your eyesight and save it. And then the third stage is the proliferative stage. And the proliferative stage is where you're getting lots of leakage, lots of fluid, but you're also getting, because the walls of the vessels are so weak, they're not able to take the blood around the eye and around the system. So new vessels are growing. And those new vessels, the walls are often too weak in those. So you get a lot of hemorrhaging, a lot of fluid leaking, and it can be quite devastating to the eyes. So there are 3 different stages, but with proper control of your blood sugar levels, you can hopefully prevent any of those happening.
That's really useful to know, Garrey. And one of the things that people often ask me is, as we age, we have our, we put our glasses on as we hit middle age. And I speak to lots of menopausal ladies on my courses that I offer, where I give them a guided path to how to manage their weight loss and how to prevent type 2 diabetes. And we look at all the different body changes that happen and try and keep in the best possible health that we can for as long as possible, so we can maintain a really good quality of life as we age, because none of us want to look old as we get older.
Yeah,
of course, I'm still 51.
Bit late for some of us.
And so it's really interesting to the people that listen to these podcasts to find out more about triggers or concerns. When should we go and see the optician? What warning signs should we look out for so that we can look after our eyesight and have good eyesight as we age?
Okay, so the first thing you should be doing is that no matter what age you are, you should be having an eye examination every 2 years. And just by having a routine, regular eye examination, the optometrist can look at your eyes. We can often predict and preempt eye conditions by doing that. So that's the first thing that we should be doing. But the second thing, if you haven't done that, some of the symptoms that you should be looking for, obvious ones are blurred vision, parts of your vision missing. They're fairly obvious, but then there are some more subtle ones. So things like your eyes are feeling a little bit gritty, or your eyes are watering a little bit. Those can be signs of an aging eye, because the blurred vision could be to do with your prescription and you may just need glasses, but it could also be related to a couple of eye conditions that we commonly see in the older generations. The watering or gritty eye can be a dry eye, and a dry eye is exceptionally common, especially in women who are in the menopausal stages and beyond, because of the hormonal changes that take place. And those hormonal changes can affect the tear film.
That's really interesting, because I've noticed as I've gone through my early 50s, I keep thinking that the mascara that I've used for years and years is irritating my eyes, and I keep getting bits in my eyes and it's a bit itchy, but it probably isn't. It's probably just my eyes getting older and not my mascara.
It could well be that. Yes, it could just be your eyes getting older and a little bit of dry eye. And assuming you're going through the hormonal changes, then that can create an issue as well.
Well, that's really useful. So is there anything that you can suggest as an optician that we can do to help prevent eye damage by type 2 diabetes?
The most obvious things in terms of eye damage, not just with diabetes, but particularly focusing on diabetes, obviously the most important thing is your diet. So maintaining a good, healthy diet and maintaining good blood sugar levels, but that goes for everybody anyway. One of the things that will help an awful lot, if you aren't eating enough leafy green vegetables, then having a supplement with leafy green vegetables, because that will then maintain the eye health. So it's well known there are a couple of vitamins and I forgot the word I'm looking for. There's a couple of supplements that you can get. So zeaxanthin and lutein. And you'll have heard of patients who have macular degeneration and have injections, and they were originally injected with lutein so that they could get enough, and that was injected into the eye. But getting a good balanced diet with enough zeaxanthin and lutein is really important. So kale, spinach, spring greens, those types of things are full of it. The other thing from the dry eye point of view is omega-3. So fish oils, cod liver oil, fish oils are full of omega-3, and that's been shown to reduce the dry eye effects that you get.
That's really good, because I know lots of people take the cod liver oil for their joints, and they probably don't realize it's also helping their eyes. So that is a really good tip.
Yeah.
So what action do you think people, particularly ladies of menopausal age who are going through a lot of changes right now, what could they do straight away to help themselves?
Okay, so the straight away, without any thinking about it, is look at the diet, a little bit of exercise, and looking at the supplements. And then the other thing is, on days like today where it's been beautifully sunny, make sure you wear sunglasses. make sure you wear a good pair of quality sunglasses, because the sun can damage your eyes. And the damage that the sun causes can also be in the diabetes. So things like cataract, it's very common in diabetics, especially earlier in diabetics. So they get cataracts long before patients who are non-diabetic. So good sunglasses, go out and buy a pair of good quality sunglasses. That will help you.
Well, there's always a good excuse for retail therapy and looking glamorous.
Absolutely. And now you can tell the husband it's for the health of my eyes.
Yes, and I need 3 pairs, because with my menopausal memory fog, I can't remember where I've left them.
Yes, one for every day.
Yes. Oh, that's really, really useful, Garrey. It's been really fabulous to catch up with you and to hear your advice for all the people that are listening today. And for anyone who would like to hear more health advice from different health practitioners and anything in the future that Garrey and I record, please subscribe to the How to Eat Well YouTube channel. And for more information, also follow How to Eat Well on all the social media channels, or you can follow Garrey with Yorkshire Eyewear on all his social media channels. Yeah. There are some websites for How to Eat Well, and there's also the website for Yorkshire Eyewear. And we have Facebook communities for you to join to, so that you can join in the discussion more privately. Been brilliant to see you today, Garrey. Have a lovely evening and see you again soon. Bye.
Thank you, Stephanie. Bye-bye.